So today I'm going to talk to you about diagnosis because people are asking me, well, do psychoanalysts even diagnose? Isn't it just the talk and cure? What is diagnosis for? Well, yes, diagnosis is incredibly important in psychoanalysis. Why? Because if I know a general category of your disorder, my treatment will evolve from that understanding. In other words, if you have an impulse disorder, I'm going to know that you need help creating some space in your brain before you go into action, meaning you have an impulse and you're in action. Those are all the impulse disorders and the addictions. You're just bypassing the brain. So my job will be to help you build brain, which happens naturally by talking. If you have a mood disorder and you are rapid cycling through, intense feelings, and then you're intensely depressed, and you just need helping with your feelings and finding different words for them. And when you do and you're friends with them, you won't be disordered by your moods. Thought disordered, if I decide you've got a thought disorder, well, then I've got to help you get back to the original feeling, which then attached itself to a wrong story, so that you can get connected to me and to other people and find a story that makes more sense than the fantasy story that your thought disorder created, which puts you out of the loop on most things. So all of these disorders, those are just a few examples, are very important for psychoanalysts to know. But then there is more, because in addition to diagnosing your disorder, I then have to know what kind of space you're in to receive me. And that level of diagnosis we think of in terms of the degree of regression you're in. If you're very, very regressed, meaning the walls are shaking and you're just a bundle of emotions and nothing makes any sense, some people are hospitalized at these points, then I'm going to be very neutral with you. I'm going to listen. I'm going to ask a few neutral questions with you, and we're just going to be together. If you're more grounded and you can think straight, then we've got a brain and we can use it. So that's a lot of fun. So there's a whole other level of diagnosis that has to do with where you're at. And I use my emotions to diagnose. My emotions are an instrument for that. If I feel in the room like there's a lot going on and my emotions are telling me that, I use that to intervene with my strategy for how to be with you.